This National Epilepsy Week, we're looking forward really to taking a breath, as I'm sure you are too, after really one of the most difficult years, and looking forward with hope through and beyond this pandemic. 25 years ago, we had a bad year. So many young people were dying from epilepsy, and there wasn't even a name for it, and it was denied. 5 of us, living miles apart, decided that we had to do something about it, and we did. In 2021, our community of thousands of families and health workers have been tested to our core. We've truly been on the front line, not just of epilepsy, but also of bereavement through epilepsy during the pandemic. And it's been our community and our alliances that have brought real hope through this. Families and health workers have been willing to share the most personal of experiences that have helped us to bring knowledge through the pandemic to those that needed to listen. Our donors, our fundraisers, the companies that have worked for us, these have been the true lifelines for the charity, so that we've actually been able to do our work, have made it actually possible through these most difficult of times. And to our sister patient organisations who faced huge challenges too, to have been able to be alongside you during this year and to have helped each other where we've been able to, has also brought huge hope. It's meant that we've been able to build a future and look forward through and beyond this pandemic, when access to NHS, epilepsy and coronial services too meant that at Pseudopaction, we've seen a 39% increase in the suddenly bereaved through epilepsy using our services. It's meant that we have been able to help families advocate. We've been able to help them count the death and for there to be learnings from deaths. It's meant that we've been able to rise to the challenge and, in the most difficult of circumstances, to have helped over 20,000 people, with nearly 10,000 of those people receiving personalised, individualised risk support. So the foundation that we've built through this pandemic is strong. Our work is sought after. Old barriers, not all, but some have come down. 50% of GPs today are able to access our pseudopaesthesia safety checklist to understand individualised risk at the press of a button. Not something we could consider before the pandemic, but that's actually happening now. And NHS England have commissioned and given us a bit of funding to do more on safety. And our voice is stronger too. Our research that you've helped, alongside national trends, which have included a doubling of deaths in pregnant women from epilepsy, show there's no doubt that more people are dying because of worsening trends on access to services and systematic past failure to prioritise saving young lives. So our work together is needed more than ever before. We know that the importance of saving only one life is worth it. We get that at Pseudopaction. So know that this year, if you have been alongside us in any way, you have done that, and you've done that and more during the pandemic. And that together, and by bringing others to our cause and building our community further with support, we can save many, many, many more lives. And that is our future together beyond COVID. Thank you.